Welcome to HealthLink. I'm Leanne Rains-Benedetto. It is estimated that there will be 2 million cases of skin cancer diagnosed this year alone, a shocking number. Here to talk about it, Dr. Brian L. Johnson. He's with Virginia Dermatology. Dr. Johnson, thanks so much for joining us. First of all, why that enormous number, and what kinds of cancers are we talking about?
Well, the baby boomers are coming of age now, and we were the ones that enjoyed the sun.
Right.
And so skin cancers have increased exponentially as time goes on.
Wow.
The main cancers we see are mainly basal cells and squamous cells, which are non-melanoma skin cancers.
And what exactly does that mean in layman's terms?
Well, non-melanoma means any skin cancer that is not actually a melanoma skin cancer.
Okay.
So melanomas are really about 150,000 this year,
Okay.
but they're the most deadly. So we tend to take care of the non-melanoma skin cancers with different surgical procedures than we do melanomas.
Okay, and it's so important for people to come in and get checked head to toe, right? Because again, prevention and making sure something that's not a problem doesn't turn into a problem, right? Well, why is it so critical for people to come in?
Well, melanomas and non-melanoma skin cancers, though they aren't deadly, can be taken care of quite easily because the skin is the largest organ and it's very visible, so it's very easy to see things on the skin. So it's very important for patients to come in and get those things taken care of.
Okay.
Quickly.
And you talk about different surgical procedures. What are the most critical in terms of people's survival or people doing well if they do have issues with their skin?
Well, if cancers are taken care of early, especially non-melanoma skin cancers like basal cells or squamous cells, they can be easily treated surgically. If they're superficial, they can be treated with creams. The type of surgery I do is called Mohs surgery, which is MOHS, which is named after the surgeon that developed the technique. The technique is used to remove skin cancers, mostly facial, with very minimal removal of normal skin.
Right.
And it gives you the highest cure rate, 90 to 96%.
And very quickly, let's talk about time. If somebody waits, what's the difference between life or death in terms of Mohs surgery, for example?
Well, usually with non-melanoma skin cancers, if you get those taken care of early, it's very minimal. With melanomas, though, if you wait, they can be very deadly.
When you wait, are you talking weeks, months? I mean, if you've got a concern, you really need to get in.
Usually within months, you need to come in and get it taken care of.
Okay, all right. And let's talk about prevention really quickly. People don't want to take the time to put on sun protection, but how important is that?
It's very important to wear sunscreens, at least SPF 35.
Okay.
Avoid the sun during the middle of the day. I never tell my patients to be hermits because it is nice to get out in the sun, but
Right.
just do things in moderation.
Okay, moderation is where it's always at with anything. Okay, so let's take a look at the information if you're interested in making sure you're getting out in the sun safely this summer. And there are the numbers to call: Norfolk, Suffolk, and Newport News. And there is the website as well. Dr. Brian L. Johnson from Virginia Dermatology, thank you so much for joining us.